Okay, so our next presenter is Jason Bang of Future Cardia, and the floor is yours.
Thank you, everyone. Can you see our screen? All right, my name is Jay Bang with Future Cardia, and we're developing an implantable cardiac monitor for patients suffering from long-term cardiac diseases. So as of today, we raised $14 million and successfully implanted in 39 patients. And we are on track to submitting all our findings to the FDA by Q1 of next year. And the approval should take another 6 months. So our goal is to be commercially available by middle of 2025. And because we are a monitoring device, we are able to capture very valuable cardiac data, the ECG, the heart sounds, and we already have in 6 short months, 70,000 hours of cardiac data that we can leverage for predictive algorithm. So heart failure is the #1 cause of death globally. So 50% within the heart disease, we have something called heart failure, and 50% of those patients die within 5 years of heart failure diagnosis. So this is a $40 billion problem in the US, and Europe is about the same, like about $30 or $40 billion a year, just an expense of managing these patients. So our device is an implantable that goes under the skin, and then all the data goes to the phone to the cloud, where the physician will access that data. So only thing patient needs is a phone, a smartphone. And the procedure is an existing procedure. So this is nothing new. We make a small incision under the skin, slide the device in, cover with a Band-Aid. And this is done in the office, 2-minute procedure, no follow-up needed. So it's very convenient for the patients and the implanters. And our device has an ECG that records electrical activity of the heart. And we have a heart sound capability that listens to the heart sound, the mechanical side of the heart. And all that data is packaged and sent securely to the phone and phone to the cloud. And this is a huge market. It's a 110 billion global market, still at its infancy. And for US market, right now, just for a subgroup of heart failure, we're looking at a $5.3 billion market. And we are a fast follower, meaning we're not creating something brand new. We're just improving what's already there with a superior technology and faster delivery. And a lot of people talk about how big the market is, and this is an actual acquisitions that happened within past few years. Abiomed had a $16 billion exit. JenaValve a few months ago, $1.6 billion. Shockwave, $13 billion 2 months ago. So this is a huge market that is happening every month in terms of acquisitions and profit. So we implanted, as I mentioned, 39 devices in the centers of excellence throughout the world. We have that data. And then we're part of, and we got our data published in JACC as part of a Duke, Maastricht, and Cardiovascular Research Foundation work. And we also have a very strong team. We're hyper-focused in one area, implantable cardiac devices development. So as a group, we have over 200 years of combined expertise in this space with 2 IPOs and multiple exits. And from a clinical team, advisors team, we have heart failure experts in the world, cardiac electrophysiology, those are the guys that work on pacemakers and defibrillators. And we also have a very strong machine learning team from Columbia, Ohio State, Duke, Maastricht University, Stanford, and Mount Sinai. Our goal is right now submit our packet to the FDA, which is very, very close, and get the clearance by 2025, the middle of 25, and then we can commercialize at that point. And our device is uniquely balanced. It's not too big and it's not too small. It's right in the middle that allows us to expand into other types of monitoring, not just heart sound, not just atrial fibrillation and heart failure, but we can go into the COPD, which is a lung problem, aortic aneurysm, which is a bleeding of the big vessel in the heart, and sleep apnea, people who are having difficulty sleeping. So those are an area in which we can grow into and starting as an ECG and heart sound capability device. So for the very first part of our goal, this alone is a $5 billion a year sales market, not projected or TAM. It's the actual sales that's happening right now. So that's the market that we're going after. The reason we are uniquely positioned in this space is our cost of manufacturing is really low compared to other companies. And our market is shockingly fragmented. We got big hospitals that manages very complex procedures, but we got many small clinics and smaller hospitals that are not doing this type of procedures when they can. So we'll focus on those areas as well. Our projection is very consistent to a implantable bioelectric devices operation. So this number is very conservative. An average rep in our space generates about $1 million for the company. So having a 2.5 million all the way to $40 million revenue is a very much attainable number. Put this into perspective. When I was in sales in this space, team of 9 did $24 million in one city. 9 of us did $24 million in revenue in one city. We can definitely do 40 million in one country in US. In all, we're an implantable device, bridging the gap between the wearables and complex heart surgeries. So we're still in the balancing the middle ground that nobody's going after. And our goal is to disrupt the heart failure with simplicity and accuracy. Thank you.
Great, thank you, Jay. So as I understand it, excuse me, maybe you can elaborate upon this point for the audience. What I'm hearing from you is that you offer sort of the Goldilocks of heart monitoring. You've got on one side of this a bigger device that's being used in the market today that is it's doing a great job of collecting all the necessary information. The doctors are getting everything that they need with that device, but it's bigger, it's bulkier, it creates its own set of issues. And then on the other side of this, you have a smaller device that's in the market, but the data collection is subpar. The doctors aren't getting what they need from this device. You're in the middle. And so my question is, why can't the big competitor or the big company come down into your space? What do you have that's protecting your device from them such that you could go to these doctors and switch them out?
Sure. So the bigger companies have a smaller device, very sophisticated, very sexy device. For them to abandon that $250 million investment that they made to start something new is a very tough obstacle for the company to overcome. So it's just not something they can do. And from that small device, they're already generating about $1 billion a year in revenue, which would even accelerate into a bigger market for them because that device will get them to pacemakers and defibrillators. So they're not all that keen on abandoning that $250 million investment. So they are pretty much stuck there. And we're seeing that because it's the same device for the past 5 years, hasn't changed. So our goal is to focus on the areas that they cannot go to. There's a massive hospital chains that are outside of the main hospital, a big heart transplant type of centers that they're not focusing on. So we're going to go after that under-penetrated, under-focused areas.
Okay, and then, so any patents, anything that beyond the fact that they've already they got these legacy investments with their existing devices, do you have any patents around this to protect or in process? Tell me about that.
Yeah, so we have 4 special patents that we filed. It's under pending status right now. One is multi-sensor within one embodiment. So that is a patent that we're very strongly protective of. And the antenna patent. So when we discuss this issue with the physicians, they complain that the current devices are lacking wireless connection because it's so tiny. And even when they get that connection, they're not doing that good of job of displaying it. So our goal was to have the best-in-class antenna wireless connection that will allow us to address the biggest concerns that the physicians are having. So we got that. And also we got the algorithm side, the data. We believe the data is even bigger than the implant operation. So we have a trade secret and the algorithm that we're also working on.
Okay, awesome. So what I heard you say is that your goal is to submit your data to the FDA by mid-2025. Is that correct?
Yes.
then how long before you'll receive a decision by the FDA that would give you the ability to start producing these devices and selling them?
Sure. So the submission will happen by end of the year, beginning of next year. And the clearance, this gray circle right here, is when the FDA will review our data and come back to us and with some questions. And that process takes about 6 months, in average, as short as 4, long as 8. So our goal is to get to the market by middle of 2025.
Okay. And then if you have a device in market, it's been approved, you've got one or two paths. One is to sell the company or to raise more capital and commercialize. So can you provide a little bit more color on which direction and why that is the right direction to head down?
Sure. As an implantable electronics, is most of us get acquired even before FDA submission or clearance. So that is a big thing. So when you look at this list here, Shockwave, Cameron Health, V-Wave, Exonics, CardioMEMS, none of these guys had a FDA approval but when they got acquired. So this is a huge number for us that other industries do not get. My goal is to get our value up, which we can control, and decrease risk, which we can control. And what the market does is the market does. It's something we cannot control, you know? So we're using this as a benchmark, $450 million is something that we want to achieve. And in terms of the product deployment, the cost of sales reps and the sales cycle is really long in our industry. So we're going to utilize independent pacer reps that's already are familiar with these type of devices and have already existing relationship with implanting physicians. They bring clinical and business expertise to that space. So we're going to leverage that. And we're not working with hospitals, which takes at least a year or so to get the contract signed. We're working with outpatient clinics, basically independent physician groups that are outside of the hospital chain. So the contract of those usually takes a few weeks, less than a month or so. So we can penetrate the market that way. And certainly we're not going to win this market on the first day, but we're going to be able to make that needle move because our device is $5,000 per unit. We're not selling a couple $100 unit where you have to do massive bulk. We can execute, handful of units per day and still generate, upwards of $40 million in revenue.
So to repeat what I hear you say, you're going to go after sort of independent practices that don't have to go through a lot of bureaucracy to say yes. And you're going to be using independent reps that already are selling into these practices, pacemakers and other medical devices. So they already have the relationships.
Yep. Absolutely.
So what kind of margins are we talking here that in commissions are you paying through that kind of structure?
Yeah. So generally speaking, in our world, in our space, 60 to 70% margin is the norm. So
okay, that's after paying your reps.
Yeah. Well, before the reps.
Before the reps. Yeah.
Reps will get about 10 to maybe 15% commission.
Got it. And then these devices, what's the shelf life of a device once it's implanted?
Yeah, they all have batteries. All implantables have batteries. So our device is good for 2 years right now. Good news is we just signed a brand new battery deal with the battery company, implantable battery company. So that will give us a 5-year longevity within the next couple of years.
And then at that point, do they have to repay to get a new device implanted? Or is this once you pay for the device, you're constantly replenishing the device?
If the device depleted sooner than expected, then there's a rebate. But if the device perform what is promised, then the new implant is a new charge.
Okay. Nick, Katie, are there any questions that you have? I have one more question.
Yeah, we have a couple if you want to alternate.
Yeah, please.
Cool. Yeah, one from Nick. He says, I'm a heart patient without the need yet for any sort of device. Who is your target market / age group / condition type when you first go to market?
Yeah, so the very first group is atrial fibrillation, patients with irregular heartbeats. So we already implanted in these patients in Europe, and 9 of them got treated. So that's our first goal. And after that, we're going to expand into heart failure, which is a heart condition where the heart is not pumping well. And the decision to make is not up to the patient. This is a physician prescribed device. So physician will make that decision for the patient. Of course, patient and physician can have that conversation, but we cannot sell directly to the patients. This is sold directly to the physicians, and they'll make that clinical decision on behalf of the patient.
Got it. Okay, great. One more question from the audience. Casey says, will this device lengthen life expectancy for heart failure patients?
That is the goal, ultimate goal. But for now, our goal is to prevent unnecessary hospitalizations. So think about it. You already have a heart condition, a bad heart. So some days you're worse than the others, right? So you're like, ooh, today I don't feel good. Do I go to the ER or do I wait it out? And that is a constant struggle between patient and the physician. Do I send him to the ER or do I see him next week? I don't know what to do. Go to the ER and we'll deal with it tonight. So that's where the patients and physicians are kind of stuck, and they cannot help each other. So our goal right now is to monitor a trending cardiac performance. And as that performance declines, we'll catch it and prevent that to go even further. And so steer the patient away from hospitalization.
Great.
Great.
We
Awesome.
actually have one more, Jerry, if that's okay.
Yeah, well, one more,
please.
let's squeeze it in.
Cool. Suzanne asks, will this be covered by Medicare or the patient pays?
That is probably the biggest, most important question. In US healthcare system, without medical coverage, insurance coverage, you cannot sell. We are covered because of the predicate devices that are already in existence, already getting insurance coverage. So they already showed value to the patients, physicians, and the insurance company that they can pay for it, and there is a benefit to the patients and the healthcare system as a whole. So our device in our category of devices have a established reimbursement of 7,600, and this was 3 years ago. So today is about 8,200. That absolutely is covered. Without it, you cannot sell because nobody can buy it. Nobody can afford to buy it. Nobody can afford to sell it.
Awesome. Thank you very much, Jay. Appreciate that.